So when patients come to the hospital and the ED physician evaluates the patient, they would activate, we would have a stroke team process. And that basically would consist of a SWAT team type of approach where the ED physician would evaluate the patient. The stroke team that consists of a neurologist will also come and evaluate the patient to determine the next steps of care. You'll get laboratory done as well. You'll get a head CT to see what your brain is doing, and then once we evaluate you, then we'll determine if you will be eligible for one of our acute therapies, but doing additional testing and getting further advice with our experts. So a head CT basically is a CAT scan of your brain to look to see if you have any type of brain like masses or strokes or bleeds. And then also we would take a look at your larger blood vessels in your brain using rapid technology, but also still in the CT scanner to take a look at your larger blood vessels in your brain to look for see if it's any occlusions there. And then depending on the patient presentation might include also what we call a perfusion study, where we look at to see if a stroke has occurred, and also around that area of stroke, if they have an area of further risk of having a much larger stroke. So those are the different tests that we do to evaluate the patient acutely to make decisions.
Sure, and I really want to emphasize what Sharon said in terms of the patient arriving to the hospital in a hospital that is that has practitioners, physicians, nurses, all the technologists. Everybody is aware of the process to be able to treat this stroke, and so everything is moving quickly because what we really want to emphasize is that once somebody has a blockage of a blood vessel, there are 2 million brain cells that die every minute of a stroke. And so time is absolutely essential to be able to make that diagnosis and bring the patient for treatment.